This lecture is about problems in the mouth. To begin with, there's mumps. This is a disease caused by a virus, and the mumps virus preferentially targets the salivary glands, especially the parotid salivary glands. And the parotid glands are located in front of the ears. And other organs can also become infected. So if you've ever seen photographs of people who have the mumps, this was a classic childhood disease, they would have a swelling here, or sometimes in both places. So, the infection itself, then. This usually occurs in people between 5 and 9 years of age. It is one of those classic childhood diseases. I had the mumps. And first exposure usually confers immunity. Okay, what do I mean by that? This is actually a really important concept that you deserve to know more about. Here, I'll get out of the way so that you can see. Here we are. First exposure usually confers immunity. What do I mean by that? Here is how your immune system works. You have basically two different immune systems, general immunity and specific immunity. Your general immune system will attack anything that it perceives as not having been made by your body. So if you get a cut and some bacteria wind up getting into your bloodstream, then your various immune system entities, usually white blood cells, they will then wind up basically attacking these bacteria because they do not recognize them as having been made by your own body. So that is the general immune system. It basically attacks anything that is non-self, not made by your body. Then we wind up with specific immunity, which is where your body winds up targeting specifically one specific disease, like the mumps, for instance. So what happens when you are exposed to something like the mumps is that first your general immune system will kick in and it will try to get rid of the mumps virus for you. But if it does not succeed, if the mumps virus manages to move in and start reproducing, and it reproduces more quickly than your body can knock it out, then you've got an infection and you get sick. Then you have to wait for your specific immune system to kick in. The specific immune system takes a while. And during that time, you're getting sicker and sicker. So what the specific immune system does is that it learns about specific proteins on that invader, and then it makes up essentially attack proteins, little attack bots, basically, that zero in on the proteins of that specific invader. Antibodies are cheap. They can be made by the thousands. And so once your body starts releasing antibodies for that particular infection, you have a hope of living. But if you have already been sickened too much, then you may die anyway. But if your specific immune system is able to kick in quickly enough, then you have a chance of actually living through this infection, because the specific immune system can eventually wipe out the invader. So that is what I mean by first exposure usually confers immunity. Your first exposure to the disease, when you first get sick from it, if you live through that encounter, then your body knows how to make the antibodies to kill off the mumps virus. And that means that even if the mumps virus is still in the air around you at other times in your life, it may get into your system, but your immune system immediately takes it out, and so you do not even realize you were sick. So in principle, somebody who had the mumps many years ago can still be immune. Sometimes immunity wanes as we age, but as I said, in principle, first exposure to the mumps usually confers immunity. Now, you may be wondering why I had the mumps and most of you didn't. And the answer is that we developed a vaccine. It's the MMR vaccine, measles, mumps, and rubella vaccine. The MMR vaccine is what makes people immune to the mumps. It's why we do not have mumps outbreaks now, usually, at least not in this country. So, first exposure usually confers immunity. Picking up on that story, then, immunization shots, vaccines, that is to say, can also be used. What a vaccine does is basically it introduces you to a very, very mild case of the disease, either with a weakened antigen or pathogen, or even with a dead pathogen. So as I said, when you are given the MMR vaccine, you are being exposed to the mumps, but in a very, very safe way. As a result, you may feel a little woozy after you get the MMR vaccine, but that's just your immune response. That is just your immune system learning about that particular pathogen so that after that, it knows how to attack it, so that when you meet it in real life, basically with a full strength virus, you will be able to crush it. That's what vaccines are for. Now, in our current era of COVID-19, we are also looking at some new and interesting types of vaccines having to do with messenger RNA. But your basic vaccines are just done by essentially giving you a very mild exposure to the disease, either with a weakened form of the disease or a dead form of the disease that still allows your body to learn about the proteins and how to make antibodies for them. So as I said, that is what vaccines are about. That is why vaccines work. They actually work with your immune system to make you immune. It is essentially a very weakened first exposure to the disease. Now, it's a good idea to have an MMR vaccine, in addition to the fact that you do not want to get measles, mumps, or rubella at all if you can avoid it. there is another problem, which is that in post adolescent males, then the mumps virus then may also infect the testes and cause sterility. What did I just say? What I said is this, is that if you get the mumps as a child, it usually attacks your parotid glands, though if you have severe cases, you may wind up having other organs attacked as well. But if you do not get that crucial first exposure, either through getting the disease or through getting the vaccine, if you do not get that first crucial exposure, let's say you then get it in later life, at the age of 14 or 16 or 30 or whatever. If you are a male, then you may wind up having that mumps virus attack your testes. And if that happens, you very likely will wind up infertile, sterile. You can no longer have children. So, as I said, this is another really good reason to wind up getting the MMR vaccine. First of all, you'd prefer not to get mumps, measles, or rubella at all, but you definitely do not want men getting it later in life because it can make them sterile. So if you are male, you definitely want to get that vaccine. And if you are female, you want to get that vaccine because you do not want to pass the mumps to your male friends. So, as I said, this is another really good reason to get the MMR vaccine. Still carrying on with what the mumps can do to you. There's also the possibility of infection of the pancreas by the mumps virus. And this may produce temporary or permanent diabetes. If your pancreas winds up being wiped out, then you are lacking the cells that help you not have diabetes. And other organ systems can also be affected. So now what I'm going to do is tell you about problems specifically having to do with the teeth. I regard this as kind of a public service thing because whether you wind up going into health or not, you are all going to wind up going to the dentist, hearing what the dentist has to say, and sometimes it can sound a little confusing. So I want to just explain to you what it is that your dentist is talking about. So we're now talking about dental problems, and I'm going to start with plaque. So plaque is what happens when bacteria that are sticking to the surface of the teeth produce a sticky matrix. That traps food particles and creates plaque deposits. So now you know what a plaque deposit is. So plaque deposits, then, it goes like this. Basically, in your mouth, there are bacteria. There will always be bacteria there. There are bacteria on your teeth. They're just there. And what happens is that they're sticking to the surface of your teeth and they make sticky stuff. And so then as you chew, as you introduce food to your mouth, which you do all the time, of course, as you introduce food to your mouth and the teeth chew the food, you wind up with tiny little particles, which can then get stuck to the surface of the teeth, courtesy of the sticky stuff that the bacteria are making. And now you have this, unfortunately, sort of perfect situation for bacteria, where they have actually taken food and stuck it to where they live on the surface of your teeth. Now the bacteria are happy. They wind up having the teeth to live on. They wind up having food to eat. They sit there, they're doing what bacteria do, and one of the things that bacteria do is breed more bacteria. Another thing that many bacteria do, including these ones, is they produce acid. It's just a part of their being alive that they produce acid. So these plaque deposits, then, these combinations of bacteria and bacterial sticky stuff and food, then, these plaque deposits feed and protect, then, the bacteria. They have a nice little home. They are happy. But the problem is that the bacteria produce acids. Just by virtue of being alive, the bacteria are going to produce acid. And then the acids erode your teeth. So now you wind up, as I said, with these acids eroding your teeth. And this produces holes in your teeth, basically. So this produces what are called, technically, dental caries. known more often as cavities. So that's what a cavity is. It's when bacteria have eroded a hole right into your tooth. Okay, so that then is how you get cavities. Now for another thing that you may hear the dentist talk about, and that is periodontal disease. Now take a look at the word and you know what it means. Where you see peri or periodol or perio, that means around. And where you see dont, that means teeth. When you see dont, dent, this kind of thing, that has to do with teeth. Peri means around. So periodontal disease, then, it has to do with the area around your teeth. Now I'll get to that on the other side here. So periodontal disease, then, this is when, still having to do with bacteria, but this is when bacteria attack the connection. So the connective tissue connection, then, near the surface between your teeth and your gums. This is the area that is known as the gingival sulcus. When this happens, when the gingival sulcus winds up being attacked and getting infected, then the gums recede. You may have seen that on people. The problem then, however, is that then bacteria can attack, that's okay there, bacteria can attack lower portions of the teeth. So they can keep going down and down and down. And eventually, if this goes on far enough, then you can wind up having the connection between the teeth and the gums actually eroded away down to the point where the tooth can fall out. All right, another problem called pulpitis. So in this case, this is what happens if bacteria wind up reaching the pulp then. Which is inside the teeth. Basically, when you have a tooth, say like this, inside the tooth, in this area here, you're going to have the hard enamel all around it. You're going to have pulp down in the middle, you're going to wind up having some blood vessels and nerves that then connect up in the gum. You know, here's your gum here. You get the idea. Anyway, the point is here you have the pulp inside the tooth. So if you wind up getting an infection in there, if the enamel is eroded away or cracked or something so that bacteria can get in there, then you have a problem both inside the tooth, and it can also get into your bloodstream and into the rest of your body, and you've got a serious problem on your hands at that point. So what do you do if you have that happen? This then requires actually destroying the pulp. And packing the inside of the tooth. So what happens in this case is that basically the tooth is that the infection is removed. It is washed out and drilled out and so on, and then you wind up having a sterile material packed in where the pulp used to be, and then you have to put a cap on top. But this is how you then get rid of a pulpitis infection. And this process of the cleaning and drilling and packing and so on, this then is what is called a root canal. So if you know somebody who has had a root canal, if you have had a root canal, that's what was actually going on with this. I hope this is making sense. Thanks very much. That's it for problems today.